So when I started the project, actually, the first thing I have to do was to gather the evidence, do a mini audit. I had to find the reasons why this is not being done, or what are the thoughts of the professionals within the team, why and when they actually decide to do the lying and standing blood pressure as part of our falls risk assessment. And from there, I realized that from random selection of sample, that it's not actually being done at all. And then I had to actually start thinking about what is the best way to actually introduce this to the team so that the assessment of lying and standing blood pressure will be consistent.
So as physiotherapists, we are predominantly involved with a lot of the patients that suffer from falls, and we can complete our assessments around that, and as part of that, orthostatic hypotension has been seen as a risk for falls. So when Alpha really highlighted this as something that we could potentially get the recordings for ourselves and work alongside the nurses and the geriatrician, then it provided us a basis for being able to accurately record and investigate a bit further. So it's been really useful in terms of adding to what we already do as part of our comprehensive falls assessment.
It was challenging to start with because obviously every one of us were trained differently. We felt that everybody have to upscale, everybody have to be trained, and everybody has to know actually what we need to do.
She's also provided a lot of the support network as well, in terms of making sure that the process is easy, that people are supported when they're doing it, and that there's somebody there to help interpret the measurements at the end, and then giving us feedback as well about those measurements, which I think has been really important as well in terms of people understanding why they're doing it. So it's been really positive, and I think it's just going to keep growing.
It's something as a profession that podiatry haven't really been involved with. Whilst we do pressures and check circulation, we haven't been involved ever with doing blood pressures. So it certainly that was something that was a little bit alien to me. But Alpha was absolutely fantastic actually with the training. Really very inclusive. So it was actually an MDT training, so multidisciplinary team. So there was the physiotherapist, the occupational therapist, myself as the podiatrist, and I think we even had actually the CPN, Karen actually came into it. So from that perspective, it was really inclusive, and it was a great opportunity to do something outside of my sphere, which, yeah, I've really enjoyed.
Based on the symptoms reported, but clearly we need to set a criteria so that it's equal in every single aspect. And for us, that's over 65 and patients who have history of falls. From that drop in blood pressure, it triggered further medical investigations. So she was sent for more scans and ultrasound of the heart. She was started on some sort of medication that will push the blood pressure up a bit, and just to reduce the symptoms, because she can't really tolerate to be upright or to stand for long because of the drop in blood pressure. And over the weeks, since she started that medication and me monitoring her progress, making sure that she's prompted to drink a lot and to follow the advice I gave her. Eventually she got there. She's now actually mobilizing better. She's a lot more independent. She's actually able to do a lot more for herself, and the best thing is she's actually able to access the community again. She can go out with her daughter, she can have a cup of tea, she can go for a Sunday dinner, which is absolutely brilliant. The changes in terms of our decision making that really is impacting on our patient. Like for instance, there was one physiotherapist after the training with the lying and standing blood pressure started doing this as well. And he came back to me one day and he said to me, I've checked the patient's lying blood pressure. This patient wasn't really very well over the last few weeks and not really mobilizing. When I checked the blood pressure, it was absolutely fine. It was 129/80. So from the lying blood pressure to that perspective, it was all right. But he said the game changer when I stood that patient up and the blood pressure dropped about 60 systolic, and that actually changed his decision making. So he felt at that point something must be done, so he rang 999 and the patient was admitted in the hospital. If that is not part of the assessment we do and we don't consider that, he could easily just continue with doing some physio work, exercising this patient, but clearly is that goal actually will make a difference for the patient. So in that perspective, it was really, really good that the changes in the decision making was affected because of that simple information.
I think Alpha has, again, she's done a great job in collecting the evidence to demonstrate how effective it has been and how many patients we've actually been able to identify that have been asymptomatic. And I think that's just helped to build momentum in terms of how many people are now interested in getting involved in taking the measurements, or at least highlighting patients that would benefit from it, and using staff slightly differently to be able to get the measurements taken. So I think it's been really positive overall, and I think uptake should continue hopefully as well, because the evidence that Alpha's collected has demonstrated it works.
I think it's brought the team together. I think it's given us a definite goal, and for the benefit of the patients and also actually the professions as a whole. So yes, definitely.